Hey, good morning, students. It is Tuesday, April 7th of 2020, and welcome back to class. I want to start out with a quick COVID-19 update. If we go to the Johns Hopkins site, we're up to almost 1.3, we're over 1.3 million people that have been confirmed, 75,000 deaths. Graph-wise, still exponential. Indiana-wise, the map for Indiana, it is really over the last couple of days, Indianapolis has become a hotspot with almost 2,000 cases. We have risen over the last few days to 40 known cases, probably more in Delaware County than 40. But you can see all the counties around Indianapolis have a lot of cases also. At this point, one death. However, our health official is saying possibly a total of 3 deaths. And then you can see Indianapolis, as far as deaths go, are at the highest. Live updates, CNN. New York obviously is the biggest area of infection in the U.S. And the good thing about New York is they are starting to see as they say, flattening of the curve. And that started yesterday with less hospitalizations, less hospital beds taken up, less intubations on patients. That's not good. I always wondered if we should continue with stuff like this in terms of exposing people. I think it is a good thing that schools are delivering meals, but it is a risk. Well, that's no fun. I hope the United States does not go to that because I pretty much outdoor exercise every day. So we've known this all along. Children, which remember the CDC considers anyone between the ages of 0 and 17 a child, or right here less than 18 years of old, get mild cases. There have been a few deaths reported. So as we've said all along, if you guys get it, we really wouldn't expect too harsh of a disease, with those main symptoms being cough and fever. We're starting where you hear some people have lost their smell and their taste. Boris Johnson, the Prime Minister of the UK, was put into the intensive care yesterday. There's Boris Johnson. All right, so live updates. Kind of surprising that CNN has nothing about hydroxychloroquine in their updates and the studies. I think someone in the United States is doing a 1,000 person study, which is huge. A lot of doctors in the U.S. have said that hydroxychloroquine has really knocked out the symptoms. And there's obviously a group of doctors out there that would say we should not be using this, but I've heard a lot of frontline doctors that have gone to it, and it's been really successful. Also, there's a group in San Francisco has bioengineered the antibodies. They are currently in, I think, rat or mouse experiments, and that should take about 3 or 4 weeks. And then after that, they could bump it up, hopefully, to primates or humans. So we could possibly get that as a treatment also. So we're looking at hydroxychloroquine, possibly. Vaccination in hopefully less than a year, and then antibodies given directly to people, hopefully within 3 or 4 months. One new update. Let's check that out before I sign off. Okay, nothing big. All right. Have a good day, and talk to you guys next week.